Good morning, I'm Jill Ludford from the Murrumbidgee Local Health District, and I'm here this morning to give an update on the coronavirus across the Murrumbidgee region. Well, sadly, since we gave our update 2 weeks ago, where we had sat on 45 positive cases for over 3 months, we've now seen 4 new cases arrive in our region, which is really reflecting some of the outbreaks and the spikes that we've seen in other states in Australia. So for the cases that we've seen, the 4 new cases, there's 1 returned overseas traveller who is in hotel quarantine, and that person is from the Snowy Valleys Shire region. The other 3 people are from the Albury region. One of those cases was a person who acquired the coronavirus in Melbourne, Victoria, and then the other 2 are close contacts of that known case. In this case, all of our cases have been isolated appropriately. All the contact tracing has now been completed, and those people have also been tested and isolated. So what's really important during the coronavirus is that we can act quickly to contact trace, get those other people tested and isolated to stop the spread going any further. We have been really ramping up our testing across the region. We're doing over 400 tests now per day, and we've done over 25,000 tests now since we started testing in May. And just for the past week alone, we've done 3,260 tests. I want to really thank the people in our region for coming forward and being tested. My message to people today is, please come forward and be tested, even if you think you've only got hay fever, even if you think you've just got your asthma flaring up, because the coronavirus can have very vague and general symptoms, and it can get out of control if people with what they think is hay fever go out into public, into cafes, and then we suddenly see a spiking and an outbreak happening. I've got some information now that I'd like to talk about where we have got some contact tracing information that we'd like to be known to the public. So these are obviously coronavirus patients who are not in our region, but who have travelled through our region. And I'd like to reassure everybody in the community that as soon as we know about a casual contact or a close contact, we put that information out into the public. It is really important for us to do that because that way we can quickly jump on any further spreading. So what we're starting to see over the last week is a whole lot of information coming out to the public about people being in particular venues and coming forward to be tested. I'm going to outline them in a minute for those in our region, but in this case we are saying to people, come forward even if you are not symptomatic. So have you been in any of the venues that I'll read out now? You are welcome to come forward and call our helpline and present for a test. For people who are not a close contact or casual contact, general population, we are only testing people who are symptomatic, but as I've said before, even with the scratchiest throat or a little bit of a wheeze, please come forward and you'll be eligible for testing. So I'm just going to read out now the venues that we have out in the public domain where we're encouraging people to come forward and be tested even if they're asymptomatic. So the first one is a COVID positive traveller who dined in the Cafe Borella in Albury at lunchtime on the 30th of June. Now we know that this particular person was only in that venue for about 45 minutes and that 14 days has passed since the person was in the cafe. So anyone who was exposed during that time would have become symptomatic during this period. Due to really good social distancing and a really good business safety plan by the particular cafe, we think that people who attended at the same time would now be considered casual contacts. So that's not a close contact. So that means they're not mandated to come forward for tests, but we encourage people to do so. So anybody who dined in the cafe on the 30th who wishes to come forward to a test, we've got a testing clinic set up in the Albury Showground, and people are welcome to ring and make an appointment and be tested. So in this case, the public health unit at the place where this person resides has been doing the contact tracing, and we were only informed late yesterday about the Borella Cafe. And that even though it's a casual contact, We really wanted to get the information out to the people in Albury as soon as we heard about it, to make sure that people could come forward for testing, and really encourage people also who are in the cafe on the 30th of June to please monitor yourself for symptoms of COVID-19. And again, even with a scratchy throat, asthma or hay fevery symptoms, you must come forward for testing and then go into 14 days self-isolation. The other one that we were working on in Monday, again, we were informed by Victorian Health this time that a person who had been positive for COVID-19 had visited the Murray Downs Golf Club. Now, if you don't know Murray Downs, it's a beautiful golf club just near Barham and across the river, the Murray River from Swan Hill. The golf club have been absolutely fantastic to deal with, and we've got a pop-up clinic set up there today. The Royal Flying Doctor Service have come in and doing that clinic for people who live there. And again, even people who visited that club on the 4th and the 5th of July, even if you're asymptomatic, you're most welcome to come forward and be tested. And just across the bridge in Swan Hill, there's a testing clinic there open every day, so you can also go across into Victoria and be tested. So just to clarify, the Borella Cafe in Albury for the 30th of June, and the Murray Downs Golf Club on July 4 and 5. So we're encouraging people who have been at those venues at that time to please monitor yourself for symptoms and come forward and be tested. We're obviously hearing a lot about what's going on in Sydney as well as Victoria. And so what we're seeing now, obviously in Sydney, similar to what we've seen in other states, is outbreaks or spikes or hotspots. And so we're seeing that in the Campbelltown region and the Liverpool region now. So we're just asking everybody to be extra vigilant, please. This is not a time for us to drop our guard. There is one way to keep ourselves safe. It's simple. It's maintaining our social distancing and also ensuring that we wash our hands and making sure that we don't attend large gatherings that are outside of the restrictions that have been put down by government. Now, we've seen some changes to pubs and clubs as a result of those hotspots. And we've seen those changes come down for good reason, because people have not been compliant. So group bookings now down to 10, and making sure that that those venues, even with larger areas, only have up to 300 people at a time, and that everybody who is in attendance at a club or a pub is registered with contact details, because we've seen how important contact tracing is when there is an outbreak and a spike. Business safety plans. I've got Tony Burns here with me today from the Public Health Unit. Our Public Health Unit are supporting businesses. My message to people in the community is businesses have an obligation to keep you safe when they're inside your premises. There are things that they must do. They must have hand sanitisation stations available for you when you come in, and they have to have the social distancing marked on the floor, so you know how far apart to stand when you're waiting for your purchase. And that's really, really important that we keep those business safety plans going, and that if you are ever concerned, please raise it with the business that you're in, because it's going to keep our whole community safe. And also, we're encouraging businesses to put the maximum number of people that are allowed inside their shop or business premises, so that you know if there's 20 people allowed in a shop and you think there's more than that you really shouldn't enter, and businesses really should be compliant with that. Finally, I just want to talk about some of the things we're doing with our hospitals to make sure that we keep our patients safe, particularly in our residential aged care facilities. In Victoria, we've seen the outbreak spread into a number of residential aged care facilities and hospitals. So healthcare workers are very vulnerable to coronavirus because they're working with people who have tested positive. So here in our Murrumbidgee region, all of our hospitals do screening on arrival, and that screening tests checks to see if people have been in Victoria in the last 14 days. We know it's really difficult for people who have, but we are not going to allow you to come inside our hospital if you have been in Victoria in the last 14 days. The reason is we know you're not going to be happy about it, and we're really not giving exemptions in these cases either, but it's the only way that we can keep our patients safe. We're also screening our staff, and not only screening our staff for having visited Victoria, we're also screening our staff to check they haven't been in those hotspot areas in Sydney, such as the Picton Hotel and the Crossroads Hotel. So we're really, really screening heavily. And you might have noticed health staff also screening at transport hubs, such as the Albury train station and our airports, of people who are disembarking and coming into our region. So what I'm saying today is your health teams are working really hard to keep you safe. We can do this together. It also relies on every individual and every community to ensure that businesses have got their business safety plans, that we're not dropping our guard, and that we are absolutely keeping our eye on social distancing, washing our hands, and making sure that we don't gather in large crowds. So thanks very much. What we'll do is I'll pass over now to Melissa Neal, who's the Chief Executive of the Primary Health Network. We work really closely, but there's some really important messaging about general practice I'd like to put forward today through Melissa. And then we'll take questions at the end, and I've got Tony Burns here from the Public Health Unit as well. So I'll hand over to you, Melissa. Thank you.